Over 4 million people are expected to turn 65 across the country this year. The phenomenon is being called Peak 65. And today we got my girl Thea here. She is with MedICare, a Medicare broker that really helps seniors select the best plan for them. And you work so hard that you recently visited Washington, D.C. to really kind of get updates on Medicare. What did you learn and what can you share with our viewers today?
So that was such an exciting trip. I'm actually a lobbyist. So aside from the fact that I run MedICare, which is a health insurance agency, I am also a proud member of the National Association of Benefits and Insurance Professionals. So I just got back the other night, which means we lobbied and sat down with our legislatures to push for great initiatives to really make Medicare better. So we've moved some needles in the past, but I think the main focus on my visit this time was to propose another enrollment period for drug plans. So every year, you folks, Medicare recipients, have a Medicare Advantage enrollment period, annual enrollment period that occurs from October 15th through December 7th. So unfortunately, some folks miss that. And then all of a sudden they find out around January that their expensive medications are not covered. So can you imagine going down to a pharmacy and all of a sudden your meds are not covered?
No.
Yep, so what we're asking the government to do is open up another enrollment period, just kind of extend it, solely focused on drug plans. Because January 1st through March 31st is another enrollment period for Medicare Advantage plans, but what we're asking for is for the drug plans. Because it's very important, you know, you don't want your folks to get stuck with a drug that's not covered throughout the year.
Right.
So that's one major one that we're trying to push. Another one is COBRA. So COBRA, as you're well aware, is continuous coverage after a person retires, right? So what's happening right now is, yes, a person can go into COBRA, but Medicare does not treat it as creditable. What that means is if that person does not have Medicare, COBRA will not operate, because anyone who has COBRA, Medicare has to be activated first because it pays as primary. And then COBRA has also to be activated. If it's not activated, A, it's not going to operate the right way. B, there could be penalties down the road. So those are the two most important push that we have proposed. Another thing is extended telehealth. So it was just so much fun to sit down. And there's more. If you follow me on Facebook or my YouTube, I will, you know,
break it all down.
And do a good explanation.
Well, we talked about, you know, this being like, you know, the Peak 65. What would you want to tell people to be ready before their 65th birthday? What do they need to know?
So this year is big with Medicare folks. 11,000 people are actually turning 65 each day. It is very, very important to simplify your life and just call me.
She'll make it easy for you.
I'll make it easy for you. I always do what's best for you to make sure that you're put in the right plan. If I know that your current plan is still the best out there, obviously I will tell you to keep that. But typically you want to make the proper maybe appointment with me at least 3 months prior to your 65th month birthday.
Okay, that makes sense. And you'll also, you know, talk with people too, because if they're still working past 65 and maybe their employer has a health plan, you can help decide, do you stay on that? Do you switch to Medicare? What do you do?
So that's a very good point. And this is a very good controversial issue right now, because people automatically think when they turn 65, they must activate Medicare because of all the misinformation that they hear. That is not correct. The general rule is, for as long as you're actively employed by what's considered a large employer, meaning working for over 20 employees, you can continue to refuse Medicare for as long as you're actively employed and continue to maintain what's called a credible coverage. And the way to confirm all of that is simply speak with your HR. Yes, and then no penalties down the road. However, when you're ready to retire, perhaps at age 70, there's a timeline issue. Make sure to come back to me, right? At least 60 days prior to, the month of whenever the group plan is ending.
Whenever it's going to end.
Yeah.
Okay, if people are watching now, they're like, yes, Thea, I just want you to handle it all. Make this my life a lot easier. How do they get in touch with you? And then, of course, are there, is there a price for the services? How does that work?
Another good question. So I've been doing this for almost 20 years. I am not just a Medicare agent. I'm your Medicare advocate. Like I said, I just came from DC. I make sure I know what's going on. We're the frontliners.
Yes.
So we pretty much know what's going on daily in the Medicare world. So I fight for you. I speak for you. I'm your voice. And I continue to make sure that you are heard at the White House or at the Capitol Hill. So I am never allowed to charge you a fee. I help you with your research, enrollment, and beyond. No fee at all. So it is best to just make your lives easier. Give us a call at least 3 months prior to the month you're turning age 65 so that I can give you proper guidance. And I'm in the local area, but I also cover most states, which means wherever you're at, you can call me. I have no bias to any insurance carrier, which means I do the extra studying to make sure that when you come to me, I will only offer exactly what's best for you. So the phone number is right there, which is 864-625-2112. You can also visit us on Facebook and YouTube, which is Med Eye Care Insurance Solutions, and the website is MedicareTLC.com. Again, we don't charge you a fee.
I mean, that's amazing. That is awesome. Take advantage of her. Use her. Make your life easier. Thank you. You make this make so much sense. So
Thank you.
We appreciate
Thank you, Megan.